Okay, perfect. So we'll go ahead and get started, and hopefully a few more people will trickle in. But thanks everyone for being here on our next speaker series for AQRI. We host the speaker series quarterly to kind of have these different experts and people working in reentry provide insight to really teach us and all of our staff in the collaborative courts different things that we should be really mindful of as we work with different populations and try to really adhere to best practices and basically continue to learn how to best treat populations. So I'm so excited to have Jenna on here today, where we're going to be talking about veterans, reentry, and how her work in the community really impacts everyone involved. And so to get started, Jenna, why don't you go ahead and just introduce yourself and tell us a little bit of your
Sure.
background?
Great. Yeah, thanks for having me. My name is Jenna, and I am a social worker at the VA. I've been at the VA for this is my 10th year in Veterans Justice Outreach. So I work with veterans, only work with veterans in the criminal justice system, and specifically sort of like pre-adjudication, like right after they're arrested, mostly in the county jail. The VA does have a whole nother program that does outreach to veterans in the prison system. But VJO is really central to outreach in the jails and then linking veterans to care at the VA. And then we're part of the Veterans Treatment Court team in whichever jurisdiction we're in. So I cover San Francisco County and I'm located at the downtown VA clinic. So many people are used to like the big medical center up at Fort Miley, and the downtown clinic is on 3rd and Harrison, and we serve a lot of homeless veterans. We have showers here and food and clothes. And this is where you go if you're a homeless veteran and want to get access to housing resources. And VJO is sort of situated under homeless programs at the VA because many veterans either are homeless because of their justice involvement or are justice involved because they're homeless. And so it makes sense that we serve those folks. It doesn't not necessarily everyone that I work with is homeless though, or has a history of that. And yeah, I'm from San Francisco. I started off in school for public health and then decided I wanted to do something a little bit more direct practice. And so I went back to social work school to get my MSW, and then became really interested in the criminal justice system. Even before that, I started volunteering in prisons back about 20 years ago, mostly trying to help advocate for incarcerated women that were co-infected with HIV and hepatitis C. And it was really interesting. And I kind of thought like, oh, this is what I want to do. I think when I heard about VJO, I was in grad school and I thought, oh, this is the job I want. And so I kind of situated myself. I was very strategic. I wrote my thesis on veterans courts. I did an internship in the veterans pod at the San Francisco County Jail. And so yeah, this is something I'm really passionate about. I really like this role as VJO. I don't, a lot of people move around at the VA, and I feel like I might be VJO for life. I don't know, but I still love it. It's still really rewarding work. And just the last thing I'll say is I have like a little bit of personal experience. My dad was a veteran. He was a combat veteran. He was an infantryman in Vietnam, and it was a very impactful experience for him. And I don't think I quite even understood how impactful it was until I was older and then saw him. I mean, at first he never wanted anything to do with the VA. He really never even talked about his experience as a veteran. And then he got connected to the VA and he got connected to treatment and got some healing. And I think seeing that made me feel like, okay, this is a good system. I mean, it's got challenges. It's the largest public healthcare system in the country, and so there's lots of bureaucracy. Um, but I think it does a really good job of serving those that have served.
Amazing. So thanks so much for sharing your
Yeah.
passion. And it's very evident in that, it's been your professional work history. I will just go ahead and plug that anyone in the audience, feel free to type any questions or comments as we're talking. I'll be sure to be on the lookout and ask them to Jenna. Just a really quick shout out right to George Hagman, who I think first introduced us as we developed our federal veterans track, which we've launched in the Northern District of California. And as part of our research and just working with the community, we understood how important it was to really have a role like yours, really working with our team in the collaborative courts. So here in the Northern District of California, we have pretrial programs or alternative to incarceration programs. We have reentry court focused programs. And I think we're just doing an incredible job trying to be really mindful about populations and really kind of the intricacies of people's behaviors, people's connection to community. And that's why I thought it'd be so important for you to be on it, right? And really help us learn about the intricacies between veteran reentry, kind of where those paths cross. And so maybe it'd be helpful for you to start off a little bit about your work in the San Francisco County Veterans Treatment Court, and really talk about your role and kind of the structure of that program.
Yeah, definitely. So my role in the San Francisco Veterans, it's called Veterans Justice Court, is a little bit of an untraditional role as far as VJOs go. Typically, VJOs, like if you look in most other jurisdictions, they're really just, they're at the table, they're part of the treatment team, and they're really just linking veterans to VA healthcare and helping come up with treatment plans. The way that my predecessors set it up in San Francisco is that the VJO is actually acting as the clinical case manager. So we're doing the clinical assessments and really like the clinical suitability for folks in Veterans Court. So there's legal eligibility that the attorneys and the judge figure out, and then I figure out, is this person clinically suitable for Veterans Court? And really all that if you were to like make it very basic, is I'm really trying to figure out why is this veteran in the system? Is this an issue of housing, an issue of untreated mental health or untreated substance use? And then building a treatment plan or recommending a treatment plan. And really, if the veterans says yes, they're eligible, they're clinically eligible. So, that's kind of like in a nutshell, the first part of what I'm doing. And then I'll present that treatment plan to the court. And then we work as a collaborative team. So every court appearance, I'm providing updates about the veteran's progress toward treatment and making modifications to the treatment plans as needed. I think where it gets a little complicated is I'm a social worker, and social workers sort of are rooted in our patient's self-determination, right? And so that is like where that's where I'm oriented, but I also know what the court's going to expect. And so sort of like working with the veteran and really allowing for them to drive the ship of their life, and also like kind of letting them know, like, yeah, the court's going to want you not to use meth, the court's going to want you to work towards housing. Yeah, so that's really my role. And it is a close, I mean, I work really closely with veterans. I'd say in San Francisco County, we see a lot of like high acuity, a lot of people with complex needs that need a bit more handholding. I'd say my counterparts in other counties, where the veteran population is, maybe a bit more functional, or a bit more high functioning. They're not doing quite as much handholding, but I think here, I kind of do whatever is needed. Some of our veteran participants are very capable of accessing the VA, scheduling appointments, and some need a lot of reminders, a lot of like, hey, why don't I take you to this appointment? And so I kind of give whatever is needed.
Yeah. So that's really interesting because your role is clinical, right? You're also a
Mm-hmm.
case manager providing just kind of um, support, kind of just from a rapport building moment, right? I
Right.
imagine your veterans maybe learn to trust you early on as
Mm-hmm.
opposed to the rest of the core team, which is a really common thing. And you're also kind of adhering to, what the legal system is telling you, right?
Yeah.
And really following that program plan. So um, that's a lot of hats to wear and a lot of different communication
Yes.
styles to balance. And so just kind of thinking through the clinical assessment component of it, right? That's information, that's data that really helps us mold, how we interact with people, how we develop interventions. Can you talk a little bit about the assessments that you conduct and how you utilize that information with the rest of the core team?
Yeah. So the VA has some standardized assessments that we use, like a biopsychosocial, which kind of looks similar to like an ASAM or other more standardized assessment tools. We don't do a risk assessment. I think that's what's different. Like PJOs don't do that, but yeah, we do a pretty extensive assessment. We also do one that's called a Holmes assessment, which is just like a VA acronym. It's really very similar to psychosocial, where but I think you're gathering a lot more information about their military history as well.
Mhm.
Um, and then I don't always do it alone. If I'm perplexed by someone, we have a VJO forensic psychiatry team, and so we meet every single week. For folks that are seen in that clinic, we talk before and after, and we're thinking in a more multidisciplinary way. I also work closely with medical providers. Let's say someone has complex medical issues. We're sort of bringing all of that in as far as our assessment. So, and another reality is that people might be well connected to VA providers before they get to me, and so oftentimes my assessment is really reaching out to those providers and the veteran and saying, like, let's all work together. Like, what do we think this person needs and how can we help connect them to that? So it kind of looks different in a lot of different ways. I'd say like there are times where like a veteran doesn't even know that they have VA healthcare, and we like the jail and their arrest is sort of their first step into getting connected to the VA. And so that is where, yeah, I'm doing more of those assessments and then connecting them to all of those other players at the VA.
Okay. So super interesting, right? Because it's kind of like, how do we get to yes among kind of our different kind of lanes, right? So we have a
Right.
client who has these ideas about what's going to work for them. We have you as a VJO, right, who has a strong understanding of the resources available. The court has a general program plan, right, based on, the population that they serve. And sometimes we're all on the same page, and sometimes
Yeah.
we're not, right? Which is kind of the beauty but challenge of these treatment courts, right?
Right.
Everyone is from a different agency with a different perspective. Um, so how do you, and this is a bit more of like the code switching or the different hats that you wear, but how do you kind of strategize how you present, your advocacy for the veterans that you help
Yeah.
working?
That's a really good question. I think you're right. It's like a lot of code switching. So when we meet in case conferencing to discuss all of the veterans who are going to be on calendar that day, we're kind of deciding like how are we going to approach this veteran? Who's going to, really, and I think the beauty of a collaborative court is it's one voice from the whole team, right? The judge delivers this voice. And instead of saying, I might in case conferencing say, hey, I think this person's struggling with their use. I think we should get some more UTOXs. Yeah, if I were to say that, if the court was to say, hey, Jenna says you should do, she thinks you're using, and she, that could really damage the therapeutic rapport. And so having the one voice from the judge saying, hey, we're really, we're a little concerned. Could you do some more UTOXs before your next court appearance? So we can, not in a putative way, but so we can make sure that we're providing the treatment that's needed, that's, to the level of care that you need.
Yeah,
Yeah.
absolutely.
The other thing is like sometimes it is really complex, and sometimes, and this is not a great outcome, is that veterans do see me as sort of aligned with the court, and then it does impact their care with the VA. That's like my least favorite
Right.
situation, because when the VA is looking at success of VJO, they're looking at, is this justice involved veteran stay connected to the VA after their justice involvement? That's sort of how they're measuring success.
Yep.
And so if they have a really negative experience in court, and then maybe with me, like, is that going to impact that negatively? So we're trying to be, really mindful. And sometimes I will say to the judge, like, look, it's really super important that I preserve my relationship with the veteran. I really need them to see me as aligned with them. Could you, word things in this way? And like, really, like, just simple word differences can make a big difference as far as their experience in veterans court.
Yeah, I mean that's so
Yeah.
fascinating because so much of the community work that we do, our goal is to support clients with all their community needs while they're with
Hmm.
us. But a lot of the time, the kind of true amazing outcome that we're striving for is that they don't need us anymore, right?
Right.
To be so self-sufficient and have so much behavior change where they're kind of unseen desire to remain in the justice system one way or another is removed, and they can be completely successful by themselves in the community without a tail of supervision. And it's this whole different concept. So it's really interesting that that's kind of a data point about how connected
Hmm.
they remain post treatment court,
Yeah.
and kind of how connected people stay. Because we always welcome people back, right? When they're doing well, when they're doing poorly, we want to see them and hear how they're doing and help them problem solve if they need them and cheer them on if they're doing well. But kind of building that connection can be such a challenging thing. Um, Before I kind of ask you more about kind of your, direct communication style with veterans in particular, one thing we're noticing more, just as far as best practices, is to try to give a little more voice and agency for veterans or clients going through treatment courts in their program planning. So,
Yeah.
unfortunately, many people have had experience in residential treatment centers or have been in recovery multiple times and relapsed and kind of haven't found what works for them. How do you kind of build a relationship or kind of understand a client's requests or agency
Hmm.
to develop their own program plan in your court?
Yeah, it's a good question. And our court just had like a motivational interviewing in service. I think they're trying to infuse that because I think motivational interviewing is really good at sort of like allowing for that autonomy and really like getting at the person's motivation.
Yeah.
Um, and I will say a lot of people come to veterans court and I'm sure other treatment courts as externally motivated, right? They just want to get out of jail, get out of trouble. Um, and that's okay. Like we work with that. We never know. I mean, this work is like so humbling because I just never know when that external motivation will turn to internal motivation and like lasting behavior change. And I've been surprised at times in a good way. So I guess a good example of how like we really try to like protect that autonomy is like sometimes I'll work with someone, I'll have done a chart review, look at their history, look at their charges, and I can kind of tell like this is someone who probably needs a higher level of care than they're in. Maybe there's someone who needs a residential treatment program, but they're just not there. They want to try something else, try a more harm reduction. We do have some harm reduction programs at the VA. And so sometimes, even though I know it won't work, or I know it's likely they won't be successful at achieving the goal of sobriety with that plan. Sometimes I'll advocate for it with the court because it allows us the opportunity to build the relationship and like trust and rapport with the veteran. And we'll kind of frame it to them as like, hey, look, we really want to meet you where you're at. We're willing to try it your way. If it doesn't work your way, would you be willing to try this? And I think people are more bought in when they feel like their voice is respected. And I appreciate that our courts patient and they allow that. I'd say it's a little bit more tough if someone like, let's say, their crimes are all like violent, unprovoked attacks on people on meth. Yeah, the court might not be so up for allowing a harm reduction approach. But if it's not, and it's not a huge public safety concern for someone to be trying a more harm reduction approach, and I'm really referring more to like we see a lot of substance use in our court. Yeah, I think they are willing to do that, and I think that is a way to build a relationship not just with me and the VA but also with the court.
Yeah, yeah. I mean, I love that approach where it's I think it works best when people are held accountable to
Yeah,
themselves, right?
totally.
When people come up with their own program plan and they're invested in it, when they don't do well, right? They can kind of reflect on their behavior and
Yeah,
consequence as opposed to kind of feeling like it's this outside entity just providing sanctions
right.
and telling them what to do. Um, it also
Exactly.
takes a long time to get there, right? I don't think it's
Yeah.
fair to any of our clients, especially people who have been incarcerated for a long time and
Hmm.
have been kind of taught how to live, quite frankly, as they're being released from custody. It takes some time where we want to make sure that they have basically a foundation of agency and advocacy for themselves first before we kind of just say, make all your decisions, because oftentimes those decisions have led them to being in the criminal justice system. So
Yeah.
it's a very, very, I think, tricky balance to uphold. But I love at least having the conversation both ways to make sure that we're being mindful of a client's needs and then utilizing, of course, your therapeutic assessment of what we're going to be working on while we're working with them. Um, so moving over to just kind of general numbers, how many veterans are you helping at any given time, and how often are you going to your veterans court?
So our Veterans Court meets every Wednesday, and right now I'd say probably in the court, we've got around 45 or so veterans, and maybe 30-ish of them have full VA healthcare. So I work with all of the veterans who have full VA healthcare. And then I've got like probably another 15 or so veterans that are in county jail in a special veterans pod that maybe aren't legally, typically it's they're not legally eligible, and that's why they're not participating in veterans court, or maybe they were in veterans court and they were terminated, but I'm still following them in county jail.
Okay, gotcha. And then as far as eligibility, does how long they served, how they were discharged factor into anything, or are there any other kind of like smaller details that we should be mindful of when working with veterans, that may affect their access to resources?
Yeah, I'd say every court is so different. In San Francisco County, we are very inclusive. So we will take any veteran you could have. I mean, we've admitted veterans that signed the contract but didn't end up in boot camp. Now I can't work with those veterans because they don't have full VA healthcare. So we've got another case manager from pretrial diversion who does the case management for those folks. But yeah, we're pretty inclusive. There are some courts where you have to not only be a veteran with full VA healthcare, but you have to have a service connection disability to be in their court. But ours is really inclusive as it pertains to sort of veteran status and also charges. I mean, yeah, we allow a lot of them. If the DA is okay with it, we'll take a veteran. And now the expansion of military diversion to felonies has meant that we're able to take a lot of those people with higher level charges in pre-plea.
Okay. Wow. Interesting. Interesting. So let's kind of talk a little bit about how you're building rapport directly, communicating with veterans. And happy to hear about how you meet with clients in the courtroom, how you've met with clients in custody, how you meet with them at the VA. Anything that helps just kind of paint a picture about, strategies
Yeah.
to work with veterans.
I really try to take a like trauma informed approach with veterans. I mean, really with, I'd say the majority of people that I've encountered in the criminal justice system have a history of trauma. Um, and I've definitely seen that, and even more so in the veteran population, because not only do a lot of the folks that we work with have complex childhood trauma, but then they've sort of joined the military, many of them as a way out of that chaos. And then their childhood trauma is now compounded with sometimes military trauma, not always, but sometimes, and certainly when we're in war times, a lot of combat trauma. And so the trauma informed approach is really about building safety and building trust. And so when I'm working with veterans, even though I might have a lot of paperwork, I'm working for a big bureaucracy, I won't frame it in the way, I won't bring down, my big stack of paperwork and start asking questions, but more sort of start from a place of like, what are your goals? How can this is giving them a short sort of spiel about Veterans Court, but then really trying to focus on what they want, and incorporating that into the treatment plan, to put my paper by the wayside and really, I mean, I think over time you can sort of get a lot of those questions answered just by having a conversation with someone.
Yep.
And so, yeah, that's what I do. I try to meet with veterans in person if I can, in a space that feels safe. We have like my office is like we don't have fluorescent lights. It's very chill. We have like food and snacks, water. Trying to make it sort of a supportive environment.
Sure.
And I do the best I can when I'm in jail. Sometimes I'm having to do assessments like while someone like at someone's door because I can't pull them out, and that is not ideal, right? It's very difficult to ask and get good information when it's not a private setting. And so, yeah, I mean, if I have to go back, if I have to schedule a Zoom, then I will. But I think it's really trying to really put the veteran first and not the court. I also, and I think our court does a good job of this too, is like really letting them drive their life. And so even our judge will say when people are like, I just want to know how much time that, it's like, this isn't about doing time. This is about figuring out why you're in this system and how to heal from that so that you don't end up back in this system.
Absolutely, absolutely. Because I mean, so much of the literature, right, and resources that are available for Veterans Court um, have a lot of military decals, the American flag.
Hmm.
Oftentimes, they start with "Thank you for your service" as a way to approach them. Can you share your ideas about kind of that as a way to build rapport, or if that's kind of advisable for judges or other court staff to be doing when they work in veterans courts?
Yeah. I don't do thank you for your service. I don't say that. I think early on in my career at the VA, I had encountered a veteran, actually, it was a Navy SEAL, who was incredibly ashamed of what they did in the service, which I don't even know completely, but really felt like for someone to, I mean, and went into a whole dialogue with me about how upsetting it is to hear that. And I know that's just one veteran's experience, but I really heard what he had to say. And I think I also thought about, my own dad, who was very ashamed of his time in the service too. I think that, yeah, for some people, I mean, some people are very proud of their service, and they probably would respond really well. You could always ask somebody, hey, how do you feel about me thanking you for your service? I have seen judges do it and people respond really well, but I think there's a power differential there. So I don't think a veteran's going to tell a judge, hey, I don't want to be, I think that's a little bit more complicated, but so I don't think it would be like a detriment necessarily, but I personally don't do that. um, I do think, though, one thing that I'm not a veteran. And so I think infusing other veterans into specifically veterans courts is really important. We have a group through we have a peer mentor who's a veteran. And then we also have a Veterans Healing Veterans group.
Okay.
And it's extremely important and powerful. And so is, when I go down to the county jail, it's a veterans pod. So there is that veteran to veteran connection. And I think, um, that's super important in our work at the VA. We have a lot of peers, we have a lot of veterans working here, and I think maybe they're able to say things or talk about military life in a different way than I ever would. And
Yeah.
that I respect that, and and yeah, I'm sort of more boundaried about it myself.
Right, right. Well, that's gonna kind of lead me to my next question about this idea of connectedness, right?
Mm-hmm.
And how much we should be aiming to have a cohort model for a veterans court, having just peers be
Mm-hmm.
available. The best practices are starting to show that isolation and social connection are just as important of a health issue as substance use and physical and mental health. And so it's something that we need to be really mindful of, where we really need to get people avoiding isolation and having
Yes.
connected for what's going to work for them. And so share with me a little bit about this peer group, right? And
Yeah.
kind of the reflections that people have.
It is, and I'm not in some of the Veterans Healing Veterans group. I'm not in them, but I was just sent a bunch of pictures of them all eating. They do like fun pro-social activities. They go to Giants games, they go jet skiing. I was doing last year, well, actually for the past few years, taking some peer mentors and then some veterans court participants to the Marin Headlands to a horse place. And we would do, they wouldn't be able to ride horses, but they'd be able to engage with horses, take them around a big pasture, and then we do a barbecue. And I mean, I will say there's something so powerful about getting this population of people that are often living in like such chaotic environments just over to the Marin Headlands. It's peaceful, and like you would really see people like become peaceful and less stressed, and hanging out with other veterans. Was so amazing to see. So as much as possible, we try to infuse that at the VA. I mean, we have all kinds of great pro-social activities for veterans. There's ones with the Park Service doing, going on trail hikes, and other sort of, activities that are safe and sober,
Right.
and with other veterans. We're a huge proponent, and I think it's like really a best practice for veterans court to have some sort of peer mentorship program within the court.
Okay, that's incredible. And I know the irony saying this that we're talking through Zoom, but getting outside and actually being
Yeah.
connected with someone else is pretty important, and we need to do more of it. And what I'm hearing from you, right, it's really it doesn't have to be a veterans focused pro-social connection in the community. It just can be something pro-social that anyone can enjoy that doesn't have to have a strong veteran theme in it. And as long as people are connected, it can be a really powerful and beneficial way to
Yeah.
work with someone. So that's really amazing. I mean, um, a big thing that I want to think through, right, is we have our reentry population. And when I say reentry, I'm thinking primarily of people coming out of custody who oftentimes have been there for 3, 5, 10 years, maybe more. At the federal level, oftentimes it can be at different places of the country, and they're being released back to the Bay Area where they haven't been here for a long time. And so a lot of times we're dealing with the institutionalization of things
Yeah.
where, learning how to apply for a job on a job posting as opposed to bringing a paper resume,
Hmm.
um, learning, how to navigate the halfway house and what reentry resources are available. And then, of course, we're commonly addressing substance use issues and getting people connected to anonymous groups, individual therapy, and CBT and everything. There's just so many different needs that we're addressing. And so, how do you this is probably another unfair question, but how do you navigate kind of all the different needs that you're seeing and really prioritizing whether it be mental health, medication, and getting people sober and happy in the community?
Yeah. It's tough because I might have an idea of what I think would be the best plan, or with you, like in all those different systems. I think in this case, I would try to like figure out with the veteran. I think people, especially folks coming out after a lengthy incarceration, are completely overwhelmed. And even just like 3 appointments all over the city is like a lot. So I think it's really about like prioritizing, like, what certainly like meds and keeping somebody stable. So if they're on psych meds, trying to figure out that right away, and sort of safety first. Is this person, I've seen people that have gotten out after like 40 years and they're so stressed that they become sort of in crisis. And so like trying to figure out, yeah, like how do we provide containment for this person? And yeah, a lot of the folks, I mean, coming from state prison or federal are going to 111 Taylor, which is very chaotic. Um, and yeah, there, and I'll try to help someone there, and they're like, well, I need to check with my federal probation officer before I can do X, Y, and Z. And so sometimes it just starts with like, can we get a release of information so that like all of us can meet together and do like a case conference? And sometimes that can really settle people, to feel like we're all on the same page. We all have the same mission, and like, let's figure it out. Let's get you a calendar. Let's not overwhelm you with stuff. Um, but yeah, sometimes there's a lot of pressing issues. There's housing, there's medical care, there's mental health care, there's whatever they need to do for court. Um, yeah, so I'm not sure if I'm answering that
Oh,
as well, but I
yeah.
think it looks different for everyone, right? Like what,
Totally.
um, and I think really like trying to tune into like what is the veteran needing, what's going to help them to stay sort of contained and calm. Is doing some of this stuff necessary right now, or like maybe the first step is like getting them connected to a peer, another veteran or something. um yeah, I think it just sort of depends on the person.
Yeah, interesting. So, as we get to know clients more and more, right, sometimes it opens up different issues to address, right, or
Hmm.
different mental health assessments that come later, which can lead to more opportunities of training, right, where
Hmm.
it's difficult to understand all of the mental health issues because the court is the court, right? They're not working in a therapeutic environment in most cases, and they're really learning a lot as we get to know clients. Um, I guess, how much do you think, in our veteran court setting should, staff learn to look or asked to learn about military service, get to know more about their childhood, and really just kind of balancing court requirement with community programs to, have a veteran progress through the requirements of court.
Yeah, I think that it's good for the team, everyone on the team, to have a general idea of what someone's background is. And so for our court in San Francisco, I will always provide it. And we have a nice database where it's on a very pretty sheet. And so they have the progress report for today or whatever the court date is, but then in the top, it's a little overview about the patient, um, their military service. So what years they served, what branch they served, what their job was in the service, whether they're service connected, what if they are service connected, what is it for? Maybe their history of, if they had any history of homelessness, diagnoses, I think are important. Um, family. Also, we include goals. What is this veteran wanting out of life, both short term and long term?
Yeah.
So that we're all sort of understanding their desires. Um, I, you know, I mean, I think it's pretty much known that people have, like most people in the criminal justice system, have a history of trauma, or many. I mean, I don't know the exact statistic, but I'd say, like, anecdotally, like 95% of the people I've seen, maybe even 99.
Yeah.
I mean, I really am having a hard time thinking of like one person that doesn't have a history of trauma.
Mhm.
Um, I won't always go into detail. I won't always like say what that, if it's, complex trauma versus like a specific traumatic event is. But I will let the court know this person has a history of childhood trauma, or this person has a history of military trauma. So they have a general idea. And kind of, I think, providing psychoeducation to the non-clinical folks on our team is really important, so they know, like, this is what this kind of looks like. This is what PTSD, how it manifests. This is how it impacts impulse control and judgment. This is how alcohol and PTSD, like, together, create context for what happened, what their charge is. And I think that information is really important for everyone to have and be aware of, because I think it can help us just be better at working with them and understanding their background. But then after that, when I'm providing progress reports to the court, let's say the person's going to individual psychotherapy, I won't let the court know what they're talking about in individual psychotherapy, but I'm letting the court know, hey, they're making it to these appointments, or this is what their treatment plan is, so that they have an idea. But I think, I am careful about what I share with the court. I don't, I also want to protect someone's privacy, and a lot of this stuff is very sensitive and
Right. Right.
difficult. Yeah,
Right, because it's probably very difficult for them to actually open up to you, right?
totally.
They think of you as just kind of a megaphone to the court, right?
Right.
They're not going to want to open up very much. And so that's a really difficult thing to navigate, right? Because I'm
Yeah.
sure there are things that are shared that
Yeah.
may be helpful developing interventions in the court setting,
Yeah.
everything. But there is that their
Uh,
privacy.
Also, another thing I include in that summary box to all of our collaborative team is, like, if someone has a specific thing they don't like there was one veteran who, like, hated to be clapped for, just felt
Mhm.
very infantilized by it. So I'll put something like that. Or someone that, maybe they're very socially uncomfortable in court, I'll ask that, please keep it brief when the person, stuff like that, so that we're, really, again, tuned into the needs of our population.
Yeah, yeah, that's really fascinating. I mean, one thing that we've been trying to be mindful of, right, is just, you know, this person's dedicated to our treatment court, but they come after a 10-hour work shift, right? And so
Yeah,
let's be
exactly.
patient with them as
Right.
they may be a little tired and not be as engaged as we want them to be. Or for the person who needs a fidget spinner in their hand, right? They're not
Yes.
trying to be rude, right? It just really helps
Right.
them focus about different things. So I love that kind of just individualized care where we're being mindful
Hmm.
of each person. It's much, much harder, right? Because we don't have a cookie cutter that works for every single person, but being attentive and trying to adapt as best we can that's core compliant is really where we're getting the change.
Yeah.
So I have a few more questions, but just kind of want to give the audience the 5-minute warning where we'll open it up for Q&A in a couple of minutes. So do feel free to write down your questions or put them in the text or in the chat, and we'll go ahead and ask them. But want to focus on you a little bit, Jenna, and kind of self-care approaches,
Mm.
how you share with other VJOs in other counties about kind of the work that you do, because it can get so challenging, right? Working with
Hmm.
so much trauma on a regular basis. And you, as a true professional, I'm sure have a strong desire to keep on doing more, and it
Hmm.
rarely feels like you're doing enough. So tell me a little bit about how you take care of yourself working with so many veterans, and also how you share your information with colleagues and come up with best tips.
Yeah. I love answering this question because I think it is so important. It is challenging, and I think you're really like you kind of see people at their worst. I mean, I mean, I'm right at the jail when someone, as soon as after they get arrested, and it's like really the worst day. And so really like I think bearing witness to that pain and suffering could be really hard. But it's also so rewarding because there's hope, right? I get to help get people out of jail and get them connected to treatment that's hopefully going to heal these wounds. I think for me, like a lot of informal consultation, I have the team of other VJOs who cover different counties. And there's something about like informally consulting with them that's like sort of seeps out, I'm not holding it all in. And so I feel like that's like processing the stuff that I'm seeing, experiencing, is helpful. I also think doing like professional development to learn about like some very difficult, like a lot of folks really struggle with people with personality disorders. It can be very difficult, and there's a lot of negative countertransference that can come up when working with folks with antisocial personality disorder, narcissistic personality disorder, borderline personality disorder. And I think learning about these disorders and sort of what they're rooted in, a lot of times it's like trauma, and this is how they navigate the world because it's how they've survived. And I think when you reframe it, it allows you to be more empathetic. And so, yeah, like doing that, like getting to trainings, doing professional development, continuing to learn, is so important. And then, yeah, just having a healthy, like, exercise, creativity. I have a dog who I'm obsessed with, family, I think that's not isolating myself, like staying connected, um, is really important.
Yeah, absolutely. I mean,
And vacations. I always have some like time off. Like even when I get back from something, I'll like schedule something else just so it's like taking the break. I think it's easy to just never go on vacation for some people, but
yeah,
it's important.
yeah,
Yeah.
absolutely. I mean, just having that circled on your calendar, just where you're
Yep.
not be checking your emails incessantly, is really important. And I love kind of what you're describing about the personality disorders, because they are unbelievably challenging, right?
Hmm.
And one thing that we try to understand is that even when a client is less likable than others to say, we're still there to help them.
Yeah.
And some are more charming than others, and we have to help them regardless. And so,
Right.
getting past that barrier mentally is something that we have to hold ourselves to.
Totally.
Um, so just as kind of like a final takeaway, this has all just been incredible information about, working with the veterans population. We have a lot of judges, attorneys, officers, court staff, therapists, community providers, case managers that listen to the speaker series. What's one big takeaway you'd want to advise for working with the veteran population?
Yeah, and I don't even know if this is specific to the veteran population because I remember this was important when I worked in other collaborative courts, but I think this idea of sort of being patient with people and that a lot of like recovery isn't linear, especially when you're dealing with mental health and substance use, complex family dynamics. People can relapse on whatever it is that's they're struggling with. And I think courts that really like a lot like continue to work with people, modify treatment plans, give people second, third, fourth. I mean, there was one veteran in Veterans Court that was in Veterans Court for like 4 years, and I think he went to 17 different treatment programs. And he on the 17th one, like that clicked. I don't know if it was timing. I don't even know if it was like, was it good food at the treatment program? Was it like someone else there? I mean, I have no idea what's going to click when and what it is that's going to click for someone. But I'd say if someone's willing to keep trying, I think we should be willing to keep trying with them.
Right.
Um, so yeah, that I think that's really important.
Yeah, I mean, that's incredible. And it's kind of this may not be completely accurate, but right, this idea of not right now, which applies to recovery, which applies
Hmm.
to someone's program compliance, right? Where if we can teach our clients the skill, just say not right now for using or making a rash decision, right, it can save them a lot of trouble. And similarly in programs, right? They may not be ready right now, and we want
Right.
back trying again when they're available and they have the energy to give it another shot. But try not to close the door on people because if they've been in a cycle of incarceration, right, at some point they're going to get out and they're going to
Yeah.
need a little bit of help. So that's incredible. Thank you so much, Jenna. Why don't we move on to a couple of questions and
Yeah.
I'll start off with kind of this two-parter from Chief Lugo, who asked a bit about kind of missing resources or missing gaps that you may have identified geographically. And the second part was how you measure success through data and metrics.
Yeah, those are great questions. So the first question, yes, I see gap. I mean, the VA, I will say this is very well resourced. I worked like utilizing Department of Public Health resources when I worked for SF County, and that was like very limited. So I will say, like, we have a lot of wonderful resources, lots of treatment opportunities for veterans. I'd say some areas where we struggle are I see a lot of veterans that go to a really like high quality residential treatment program. Maybe they'll go there for 30, 45, 90 days. And it's so amazing. They're really like doing well. And then the problem is then we put them right back at home, right in the middle of their apartment in the middle of the Tenderloin, and they of course struggle. It's a terrible environment to, that's not really conducive to ongoing recovery. And so one thing that I wish we had access to was like sort of long-term sober living, supported sober living in an environment that's really supportive.
Right.
And it's just not something that, I mean, I think it's not just the VA that struggles with that. I think that's a struggle for a lot of uh, communities. And the other thing I'll say is that we're seeing this, and I don't know if you guys are seeing this in the federal system, we're seeing referrals from like aging veterans that have dementia, and maybe they assault a family member or something. And a treatment plan for someone like that is a lot different, right? What they need is probably something like a skilled nursing facility or a board and care. And we're really lacking, I think, in our community as these baby boomer generation ages is good housing support for folks that are aging that might have cognitive issues, dementia. So that's something I wish we had. And then the question about measuring success, we don't use metrics. We don't use like, there's nothing that we're scoring veterans. I mean, it's pretty individualized and it's really in our court, we use phases. And so, like, the first phase is more stabilization. And then the second phase is really focused on, like, sort of rebuilding. And then the third phase is like they're, stably housed in their own housing, they're got a plan for work or school, and then we sort of just decide as a team when someone should graduate. And I'd say of course their case is involved, like if it's a misdemeanor it's less time than a felony, but it really is quite individually based. And then it's the other thing that sort of that we're keeping mind of is goals, right? Has this person met short-term goals? Are they working on those long-term goals? That's something we try to be focused on.
Right, right. So for the longest time, right, the adult best practices were phases, and usually that was tied
Right.
to sobriety and program compliance, which is much easier to measure
Totally. Right.
someone than setting these tangible goals, right? Like
Yeah.
gainful employment and working 40 hours a week is measurable, but what if
Right.
someone's working 32 hours a week and it's only contract work, right? Does that still
Right.
count as being successful? And so there is a movement, right, towards setting goal-based for phasing through programs as opposed to just kind of the ticking time of
Yeah.
but um, it's a balance. It's a balance.
Yeah, totally. It's a balance. And I mean, I'm thinking about a Vietnam era vet who like hadn't been to the doctor in 40 years and was sleeping outside like for decades and decades. Like for him, success was getting him housed and getting him connected to medical care. And we sort of didn't prioritize his lifetime use of substances. And the judge actually agreed to graduate him still. I mean, he had decreased his use, but wasn't completely abstinent. And still today, it's been like 6 years, he's still housed, he's still connected to the VA. So like that is a lot different than maybe someone else who we might, have higher expectations for.
Right,
Yeah.
right. And I think that's the beauty again. I think we were talking about it a little bit before, where getting these trusts in these large systems
Hmm.
is where we can actually have this behavior change. And so one thing we've been trying to implement across our problem solving course is just before you graduate, let's make sure that you have health insurance. Let's make
Hmm.
sure you have a PCP, and let's make sure you've had a physical within the last year. And
Yeah.
the idea is just that I want you to be mindful of taking care of yourself and utilizing the resources that are available to you. So I love that idea of public health. Um,
Yeah.
one question from Megan was, do you assist with out-of-state program placements?
Yes. And in fact, sometimes those are our greatest success stories. One thing that's very good is that the VA is everywhere. And so we do have veterans who we have a lot of like transient veterans that like are open at many different VAs across the country. And let's say they get arrested in let's say they're just visiting and get arrested, or they have support in, I don't know, Massachusetts or something. Um, if I can, work with their family and the VA in their hometown or wherever. Sometimes we send people out of state for residential treatment as well. And then they like do so well and stay and decide never to come back to San Francisco. And like that's great. If
Yeah,
San Francisco is not a good environment for folks, I mean, we do have a lot of veterans that like end up here and like they're using substances and they're struggling with housing. And so our courts really uh, open to that. We allow people to appear by Zoom, and
okay.
then I can look at their VA records in whatever state they're in, and I can communicate with the program. And so we absolutely assist with out of state program placements.
That's incredible because so much
Yeah,
of um, the work, right? Sometimes it can just be environmental, right? Where if we get someone
totally.
out of their neighborhood and
Yeah,
it's common in recovery, right? The people, places, and things that you've been
yep,
around. If we can get people away from that and just making new connections that mix with kind of aging out of a lifestyle that isn't productive for them, we get the true success, right? And it doesn't have
yeah,
to be out of state or cross country, right? Sometimes it's the move from San Francisco to Napa, and
yeah,
uh,
yeah.
just kind of this entirely different environment. So that's really great. I'm gonna go ahead and just open up. If anyone has any other questions, feel free to come off of mute. Go ahead and point to George.
Thanks, Wyatt, and thanks, Jenna.
Yeah.
One of the common threads that I've heard today is that veterans are not a monolithic population. I mean, you told the story of the Navy SEAL, and thank you for your service. And he didn't like to hear it because he had traumatic combat experiences, I presume. Whereas there are other veterans who have been to combat and they're doing okay. There are many veterans who haven't been to combat, different eras. Uh, some were spent 20 years, some spent just one enlistment.
Hmm.
Um, and so my question is, to the extent that you can, are there any common threads that you see, common techniques or tactics that you find especially effective with the veteran population generally that you might not see effective with other populations? I'm thinking, for example, like appeals to discipline because
Mm.
they're used to being in a hyper disciplined environment, or appeals to a chain of command because they're used to that,
Yeah.
or appeals to community service because they see themselves as servants. Are there any like common techniques that are particularly effective?
Yeah, I mean, I do actually see all of those things. I see there's a lot of respect for sort of hierarchy, and like you see that in court, right? You see how veterans are with the judge. You see that, I mean, in the cover pod at the San Francisco County Jail, I remember like hearing that pod, they win, I don't know, win's the right word. They for every week at the jail they have like inspection, and they are like constantly doing the best as far as keeping their area clean, as far as like getting along together in this community. And I mean, they're on top of each other there, and they're still like so respectful with each other. I was just there this morning at like the community meeting, and there's so much camaraderie. I think there's so much like respect for other veterans. I think the other thing I do see is like a lot of the veterans in our court want to give back to the veteran population. I hear that all the time. We used to have a requirement for community service in our court. It kind of, since the pandemic, changed that. Um, but like one program that we worked really closely with was Warrior Canine Connection. It was a program that where veterans in the justice system trained service dogs that would then go to mobility impaired or psychiatrically impaired veterans. And there was this like restorative justice element. And veterans like loved it. I mean, here they are like preparing this dog for caring for one of their brothers or sisters. And so I think if like as much as possible, like if we can infuse that in veterans courts, I think people really respond well. Of course, like everyone, Vietnam era vets are different from post 9/11, and the wars look so different, and wounds of war look so different. I mean, you see a lot of veterans like post 9/11 with like TBIs. There was, multiple like IED explosions were like a brand new thing they didn't deal with in Vietnam. And so I think you see different issues sometimes. I really just try to like figure out what each and every individual veteran is wanting, and as far as like community, as far as like how we engage with them. And so it is very individualized, but I would say like, yeah, creating this community of veterans is like really important. I think veterans really respond to that. I hope I'm answering that question. Okay. If there's any, yeah, I know it's different, with the federal court, you guys don't, for your veterans court, you don't have like, there's not like all the veterans going to court on the same day and like sitting together and having, or, being able to get coffee after court. That doesn't exist yet, but maybe it will in the future. Yeah. And they also kind of like in veterans, or in the cover in the veterans pod, I see this like they kind of talk about this actually just happened today. They were telling me all about Judge Breyer. Like I guess multiple veterans are going to be in front of Judge Breyer, and they sort of like help each other and tell each other what. I don't know if that's helpful or not, but they really talk and try to support each other.
Yeah.
Great question, George. Thank you for that. So just to start to wrap up, Jenna, any final thoughts, ideas, or questions, or things that we didn't cover today that is on your mind that you wanted to share?
I mean, the only thing is that I'm just really looking forward to, serving the veterans in the federal system. I mean, we occasionally have folks that we see, but not very many. And I think that's a missed opportunity. And I'd love to, get more involved. And I also just want to say, like, all of our NorCal VA systems, Palo Alto and NorCal, are aware of the Federal Veterans Court and are all really supportive. So yeah, we definitely just want to get more involved.
Incredible. Well, thank you, Jenna, so much for sharing all of your knowledge and expertise and working with the veterans population. We're so excited to work with you, and we're so lucky to have you on our team to help serve the veterans. So thank you so much for taking the time to chat today. And thanks everyone for joining. We're gonna end the recording here and share it on YouTube later to be watched as well. So thank you everyone, and I hope you all have a great weekend. Great.
Thank you. Take care.